for joining us all the way from. Are you in Shanghai today?
Yeah, Shanghai.
Yeah. Well, welcome to you from Shanghai. This is. I'm just going to switch off the.
Hello. Hi. Good morning.
Good morning.
Welcome. How are you?
It's very disconcerting hearing the live stream in the background. Two seconds in delay. So welcome. And Alexander English is joining us. All the way from. Are you in Shanghai? Is joining us today from the Shanghai Intercultural Institute at Shanghai International Studies University. I hope I've got that right.
Mm-hmm.
And you will be talking to us, as I understand it, about face masks and lockdown, a move towards a new global norm. And we've heard about individual norms and cultural norms and indeed societal norms. And I hope that we will be able to now zoom in on this very specific kind of change in norm, and maybe in our post talk discussion, try and think about some of those very specific ways, specific terms, as introduced by Ophelia de Roy in her keynote on Wednesday. But before we move into discussion, let's hear your talk. Do you want to share your screen with us?
Sure. Is that all there?
Yeah, looks beautiful.
Okay, thank you.
And over to you, Alex.
Well, thank you very much for this opportunity. I'm very happy to be able to represent a unique perspective and maybe answer some of your calls that you just made in the introduction here this morning about cross-cultural differences and this lack of, an understanding of how we may be seeing changes in the COVID experience from unique parts of the world. Well, I'll be presenting two studies. One that was done very early on in China, which is also, I think, unique to this conference. I don't know if anyone's spoken about China and the experience within Wuhan and the neighboring provinces of China. And then later I'll talk just generally about my global project of collecting data around the world. First, a special thanks to those who helped me with my mask observation study. These people put themselves in harm's way very early on in the outbreak, and went outside and observed people wearing masks and not wearing masks and collected some awesome data. And we are in the final stages of the paper that we'll be putting out very soon. For my global COVID project, I have over 40 collaborators from 35 countries, and I want to thank them for their efforts in translating surveys and collecting data during lockdown and during the tough times that they were experiencing. And this would not be possible without their help, and also from my mask observation team. One thing that we can now say for certain is that there's a new global norm. Growing up, we would always sort of characterize the experience of 9/11 as that defining moment where everyone will remember that day, that moment when those towers were coming down or whatever. But now we have this new global norm, and that is COVID-19. It is not one memory, but is it a shared collective memory by everyone around the world? We may in the future be asking people that we meet or haven't met it for a very long time, when did you first hear about COVID-19? Where were you? What were you doing? Or perhaps we may ask, hey, where did you experience lockdown? What did you do? What was the life like there for you in that, other part of the world? For me, I must say the experience happened when my mother sent me an email in early January with a newspaper clipping saying that this new viral outbreak was emerging in China. She told me to beware, and I simply replied saying, Mom, don't worry, it's not a big deal. China has them all the time. They had SARS 10 or 15 years ago. There's so many temperature checks all over the country, and plus Wuhan is so far from where I am in Shanghai. There's no way it will make a difference. Right after the outbreak hit, I posted on Facebook saying, here's the best source of information for this deadly coronavirus. Luckily, we're safe here in Shanghai, but we need to get ready and embrace for the millions that will be traveling back to Shanghai after the Chinese New Year. Back then, there was no Johns Hopkins website direct link, but that URL there links you directly to those early days of Johns Hopkins, where they were just reporting the cases within China, and now if you look at it, it's quite different. Now in China, I will report everyone wears a face mask when they go out. It's basically your new phone, your key or wallet. We show our green health code, we get our temperature checked when we go into malls or supermarkets, and we naturally keep distance from other people that we don't know when walking on the streets. But back then, during those early days, 76 million people went into lockdown in Hubei. Everyone was afraid. No one went outside. The streets were empty. It was cold and gloomy. We all knew that face masks were important, but they were sold out. And people were waiting for 14 days to make sure they were free of the coronavirus. This is one thing that makes the experience of China quite different from the rest of the world. There was a complete unknown aspect to this virus that no one knew anything about. Little was reported, and everyone just lived in fear, wondering what was going to happen next. A common theme of this conference thus far is COVID is not done with us. And it is true that COVID has changed the world permanently. I just checked the news today, and there's a small cluster in northeastern China where there were 2 reported cases. And if you think about that number, 2 in a city of 15 million sounds like nothing. But they are now about to test 1 million people to make sure that the spread has not gone outside of this region or spread to other parts of China. If we think about that in global comparison, that is quite different from where we are in the world. But one thing that remains very clear and certain is that face masks are now a staple of this pandemic life. But this was not always the case. And in some parts of the world, it is still heavily and very controversial and debated, quite often and very harshly in some cases. But during the early days of this COVID outbreak, or what we would call back then as the SARS-like pneumonia, it was first reported in late December of 2019. And I use that data as my marker for days since outbreak as I report on my studies. But during that time, no one really knew what was going on. It wasn't until early or mid-January that people started sensing things were different. And in fact, January 20th to the 24th was this crucial, ambiguous time. People had heard about this unknown coronavirus. They had a sense that they should be careful and be wary. And in fact, people were beginning to recognize the sheer severity of this outbreak. It wasn't until Hubei and Wuhan went on lockdown, the 76 million people that I talk about, that it was officially now a major threat. And in the scheme of things, thinking back to Western media about how China had taken this draconian measure to lock down an entire province, seems quite normal in our normalized world that you would do that when there's an outbreak as severe as it was. So what my team and I did was we started very early during the outbreak. All of my team had returned home for Chinese New Year. And in fact, Chinese New Year is January 25th, a time which is like Christmas, where everyone's with their family and spending time at home. No one's going out. So at that time, everyone had already gone home. But I asked my collaborators and myself to go out and sort of observe people in the environment, collect data indoors, collect data outside on bus stops, outside subway stations, and just observe, are people wearing masks? Are they not? What type of masks are the people using? What's the age of the person? We collected over 1,300 responses in 7 cities, and we were able to do some intense analyses. But first, a little bit about the sample. So Wuhan is the epicenter of the original outbreak for the coronavirus, and it's centered in the middle of China. It's a major hub for transportation from north to south, east to west. People that were returning home had to travel through Wuhan and traveled home in fear. Unfortunately, we couldn't collect data there. I didn't have any collaborators, and no one was willing to go outside during that time. But we collected data in the north, which we call the wheat part of China. And we collected data in the south, which we call the rice part of China. And you may be asking, what wheat and rice, what does this have to do with COVID? And it's important to know that rice and wheat are an important cultural variable that explain cross-cultural differences or within-country differences within China. The southern part of China is a rice farming area that's been fostered for thousands of years, whereas the north is a wheat region of China. One thing that's very important about rice farming is it requires irrigation. It requires farmers to coordinate with each other and sort of engage in a community type of experience where they're sharing water and they're also engaging in a functional interdependence. And this has led to not we're not surveying rice farmers, but this has led to an historical legacy that we now know as the rice theory, which has led to more of a collective culture in southern China. Whereas wheat farming has produced more of an individualistic or an independent sort of culture. There's conclusive evidence that has found rice-wheat differences. Rice areas tend to be more interdependent. People in those areas tend to be more flexible and think more holistically. Rice farming has also been linked to cultural tightness, and this is not only in China but worldwide, meaning rice farming areas, people live in a very tight-knit community and they sort of abide by cultural norms that are very tight, whereas loose cultures tend to be more open-minded and more able to sort of adhere or have deviance from the norms. This is outside of the scope of this study, but you can look to those references if you're more interested in this rice-wheat theory. But more importantly is the sites that we sampled varied in rice amount of paddy farming. Shanghai is in historical aspects is a very rice farming area. Almost 93% of the area is used for rice farming. Whereas in the north, Beijing or in Taiyuan, there's less rice farming. There's almost very little. So one thing we're going to test is it possible that people in rice areas are reacting faster given this collective sort of compliance? The person around me is wearing a mask. Well, I should go home and get my mask, or I should go and buy a mask, or, oh my gosh, I need to sort of protect my family and my friends. I better get them masks. Whereas in the north, is it possible that they're sort of following a trend of listening to the policies from the government, or they're engaging in more an independent sort of style where they're just kind of like, whatever, it's fine. I should be fine from COVID. It's very important to note time is a very important aspect of our study. As I mentioned, we started right at the beginning of the coronavirus outbreak in China. We observed only 37% of people wearing masks. But one day later, we found it increased to 62% of the people that we were observing wearing masks. On Chinese New Year Day, we only found 43% of people wearing masks. You can see this blue line represents the trend of mask usage. This lighter blue shade here were the days that we were not able to go out and observe. Obviously, we were on lockdown and everyone was very scared, and there was a lot of concern about catching COVID. So I couldn't ask my collaborators to go out and risk their life and go collect this precious data. But we were able to get 14 days of data, and we're able to show that there is a great increase of mask usage over these days, almost to complete compliance of mask usage, around 94% of mask usage. I recently asked my friend in the US, when they're in the supermarket, how many people do they see wearing masks? And they did a quick estimate, and it was around 40 to 50%. And we achieved, Chinese people in China achieved that by the second day. One important aspect of our study is we're able to look at demographic differences as well as cross-cultural differences of this mask comparison. And we found one shocking and important finding that we really need to consider more is the fact that older people were wearing masks to a lesser degree than younger people. Only 37% of our sample over the age of 50 were wearing masks. Obviously, it's not necessarily a sampling bias because there are tons of stories in the news saying of younger people having to force their parents to wear masks. It's almost like they sort of just disregarded it, or there was this sort of lack of compliance, or they didn't care, or they just didn't feel the need to. It wasn't until their children were forcing them to put on the mask that they were finally wearing the mask when they were going out. We found that women were wearing masks 60% compared to men, 52%. And we found that people were more likely to be wearing masks indoors than outdoors. And people who were riding buses were less likely to be wearing masks. And we sort of interpret this finding as it's possible that people who are riding buses in Chinese cities are less wealthy and probably don't have the resources to have masks. And also, it's possible that it was just so early that we were observing these bus stops and these buses that it was also a site effect and a time effect. But it is important to note that this indoor-outdoor effect held constant throughout the study. One other important thing is we found urbanized cities or population density there was more mask usage. So in first tier cities, we would classify as more urbanized city centers like Shanghai or Beijing. They were wearing masks to 70% compared to smaller cities, which was around 30 or 40%. And of course, that makes sense. They're in a rural, distant area from the city. They have more space. It does make sense that they would also be wearing less masks. So the question is regarding this presentation and this part of the study is, do people in rice areas respond quicker to COVID and wear masks more often? Or perhaps put another way, are they overreacting given this information? You know, it's so new and everyone's going through this fear and wondering, what should we do? Should we wear masks? Should we stay indoors? There was no announcement from the media or from the government. And we found actually that people in rice areas were in fact wearing masks to a greater degree. Almost 60% compared to the wheat areas, around 40 to 45%. And this remained consistent through the 7 to the 12 days that we collected data. But what we found that was most important, was about the mask policy. It was almost like once the mask policy was implemented in those rice areas, that's when we found this sharp increase in mask usage in those areas. Whereas in wheat areas, we didn't find such a fast compliance or a fast response like we did in rice areas. So that's very important to note. We also found a mediation effect of cultural tightness, meaning that in rice areas with more cultural tightness, there was obviously more mask usage. This was a partial mediation, but it explains some aspect of the variance. And it is important to note that in other aspects of our study, we have been looking at the role of cultural tightness, the amount of tightness within the community and how much that could impact the compliance or the mask usage. So some key takeaways from this part of our data that I'm presenting today is that we found from on the ground in China during those early days of this coronavirus outbreak that was unknown to the world or to China, it revealed some rational and some irrational behavior. We could say that. It's rational to expect that people would wear masks in places with more infections. So we did find that when there was more COVID infections, there was more mask usage. Places closer to the epicenter, so the distance to Wuhan, negatively predicted mask usage, meaning that if you're closer to Wuhan, you're more likely to be wearing more likely to be wearing masks, and also places with more denser populations. And it's also very rational to expect this mask break spread, and also as local governments implemented this mask policy. So it's really important to see how this plays out cross-culturally in other cultural contexts that, you know, have implemented masks or we would say sort of mask mandates, which is by law, or mask guidelines. In the US, there's this clear distinction between guideline and mandate. Once there's this mask mandate, we'll be very interested to see how the data turns out. So, you know, given this project took place in the end of January, early February, and COVID had just sort of ended for us here, we would say, we're not out of it yet. I was watching and observing the world before my eyes, and I sort of had this magic ball and could see the future of what was going on. Sadly to say, and very unfortunate, but I knew that I needed to jump on the opportunity to get hands on some data in other parts of the world. And I knew that this mask phenomenon was something I needed to look at. What we were really interested to look at was the role of time, location, and environment. Meaning time, where are you in this COVID experience? Are you at the lockdown? Are you just going into lockdown? Are you coming out in phase 1 or 2? Where are you in terms of location? How far away are you from this epicenter, like from New York or from Lombardia or from Wuhan? And also the environment. What are the people around you doing? Obviously, there is this impact that we have to look at and have to understand fully. So my team and I collected data around the world. You can see all the dots at various spots. Each of those sites is where we had someone collecting data, but we have data from way more countries than that, just given this sheer size of this. And originally, this project started as a way of looking at immigrant communities that were experiencing COVID from a distance. I'm from the US, and I was in China during the outbreak. And I was, obviously dealing with it here. My family was worried about me. And then I was thinking about Chinese students and expats who were living away from their families as they were away from the COVID experience in China. And then there's this sort of double trouble when all of a sudden now COVID has left China and China seems to be under control. And now they're being hit firsthand with this experience of being away from home and going through COVID almost again. So we began looking at this migrant experience or minority population experience. And we were really interested in looking at discrimination and racism to wearing masks, and also the way people were communicating and how they were changing their styles of communication during the lockdown and COVID phase. But over time, this really changed and morphed into something way beyond my stretch. I heard last night from the Cal State team about how they've been adding in measures and taking things out. I left my survey standardized, but I was able to capture a good enough various degrees of measure to suit my interest and to suit my research questions. The first one is about the perception of COVID. How do you perceive COVID in terms of changing your life? What is your subjective perception to this sort of ability to adapt to the new COVID life? Because we're all in it. We all have to adapt to some degree, some more than others, and some are at various points in that. The second point was about mask usage and emotional feelings and attitudes towards masks. And then third is about those news sources. Where are people getting information? There's been so much misinformation going on, but where are they getting the information? We have collected data on that. And social communication online versus in person. That has been a very important variable to look at is, are you still engaging with people in your familiar sort of realm, or are you more online? Also exclusion and discrimination, and we have a coping mechanism, depression, and then down number 8 and 9, are cultural variables. One is the triad task, which is a way of measuring people's thought style. If someone has a pairing like a monkey and banana, that's a relational pairing because monkeys eat bananas. But if you have a panda and monkey, that's a thematic or categorical pairing. Panda and monkey are animals. That's more thematic or analytic. So we're looking at the role of thinking and thought style in people's experiences with COVID. And more importantly, this number 9 has to do with relational mobility. How do people perceive the emerging environment around them? Are there abilities for them to make friends and to interact with others, or are they more sort of closed off? And actually, there's been an excellent paper published on this already, looking at country level data of 37 countries with this relational mobility. And they found that those countries that have more relational mobility, meaning they're more open to experiences and, more able to make friends and break ties, are being more impacted by COVID in terms of the infection rate spike than those that are more closed off. And then obviously demographic factors. I want to highlight one that's been very important, and that is where are you? The question is where you grew up versus where you are now. This variable is really important because it grasps a lot of people that have been stuck in limbo. There's many international expats that are stuck in whatever country and can't travel back because of the restrictions. And we're able to capture where they're from and where they are now and how long have they been living in this environment. Many people are stuck out of China that sort of fled China during the COVID outbreak, and now they're stuck in Vietnam, Bali, all over the world, and they're stuck in this place and they can't come back. So it's been a very important variable to consider. Sizing a lot, but I will just say my main interest is number 1 and 2 and the relationship between 1 and 2 at the country level and regional level, meaning how do relational thought and relational mobility change across cultures as people are experiencing COVID? And also, how does this mask usage relate to coping strategies and how is it linked to cultural thought and to mobility? Are people that are seeing others wearing masks more likely to wear masks themselves? Or are they also more likely to adhere to the policy states, the provinces, or even the countries, right? I think that's one thing that I noticed in previous talks that has been neglected is looking at this regional data or, state level data or province level data to unpack these policies or lockdown implementations to see what's happening when people are having it happen. So here's my sample, 11,000 people from 34 distinguished sites. 63% of these 11,000 people reported being college educated. At the time of completion, 42% of them had been currently employed. We did ask in the later batch of data, have you lost your job since COVID? I haven't analyzed that or looked at that. And we did start this survey, I think, also quite nicely at a very early juncture in the COVID experience. March 15th is right after Italy got hit and most of Europe was going on lockdown and before US was really getting hit. So I do want to say that our data represents a very nice, the first wave of COVID impacting the world. And then you can see 52% of our sample reported wearing a mask, when they go outside. So given my interest in mask usage, I'm going to graph it and show you exactly what we see. So here on the y-axis, on the x-axis, we see days since outbreak. So this is basically January 1st, and this is the last day we collected data, 140 days later, so in June. So if you think January to June, when do people report wearing masks? We asked them, about approximately what day did you start wearing masks? And then this is on the y-axis is the number of people who have reported wearing masks. So here, what's interesting is we see that first wave of people reported wearing masks at the appropriate time, right when China was getting hit by this, COVID infection. And then by mid-February, we see an impressive sharp increase again. And that's again when South Korea reported the infections. Obviously, not all these people from this point are from South Korea, but the general trend seems to be in line with these outbreaks. And then finally, around 60 to day 60 to day 70 is around when Iran and Italy got hit, and we have data from both of those sites. And then around March 15th, when we started the survey, so this is people looking back and self-reporting when they wore masks, we had this nice, huge increase in the Europe lockdown. And I think this represents a lot of the Chinese international students that are living abroad, and also people, I think in Czech Republic was the first country in Europe to implement this mask policy, followed by Austria, I believe. And then finally, UK goes into lockdown, 5 or 10 days later. And then here, at 90 days into the outbreak, the CDC finally recommends masks to be worn in the US. And this has been a huge controversy because the Surgeon General and many health officials in early February and in early March were saying masks are not useful, don't wear them. And then suddenly reverse course by saying everyone should wear a mask. And even more so today, now people are basically mandated to wear masks. Fortunately, we were able to collect data during these time points between February and in April. And one question that we asked, well, why aren't you wearing a mask? And this plays right into Meryl's question earlier about this lack of control or this sort of sense of unable to control my ability. And it's very clear. Well, I want to wear a mask, but people think I would be overreacting. Well, masks have been sold out everywhere. I can't seem to buy one. Or hear someone from Denmark. I wear a mask, but people in Aalborg don't. So they suppose I must be suffering from the disease. Or hear someone from Germany. I can't find any and not sure if I would wear it because no one does. Or hear someone from the US. When the epidemic started, locals did not wear it. We Chinese students are afraid of discrimination or even violence because we wear masks to go outside. Or in Italy, there weren't enough masks even for healthcare workers. The majority of people around me do not wear masks. They think it's for sick people. And finally, I worry about being discriminated against. So here's a clear example of this lack of control where people want to control themselves and be safe when they go outside, but they have this repercussion of being actually physically assaulted in some cases or have people, mock them or whatever it is that happened early on in the outbreak. And this is going to be one important aspect of one of our studies, one of our papers that we'll be writing is looking at these groups of people and the experiences they went through and understanding what can we do later? What can we learn from this? And how did they truly suffer compared to locals? So going back to the data, those other two spikes there were from our Russia and Brazil sample. And fortunately, we were able to get them right at the peak of their apex in the outbreak. So we were able to capture their experiences as well. So another thing I want to just show you clearly, because I know my time is up and I'm not presenting any formal analyses from this big data, is just kind of show you some other interesting results that we've seen regarding this mask variable. Here, we ask people, when did they hear about the coronavirus? Just give us a rough estimate about, where were you, what were you doing, and about the day that you heard about it. And then we took the average at the country level with at least 10 people per country to represent that sort of COVID knowledge score. And we graphed it by date. And then on the x-axis here, we have the mask by citizen, the amount percent. So these are the amount of people wearing masks around them and themselves. And you can see, shockingly, the east here is this red dot, represents all of this area above this red line, meaning Hong Kong and China and the region of Taiwan, Vietnam, South Korea, Singapore, Indonesia, all heard about the COVID early and report wearing masks more greatly than other parts of the world. Here, New Zealand, Ireland, all of these blue dots represent the West. Again, this is when they took the survey. We would expect hopefully by now that all of these have sort of shifted up maybe 20% as we know the efficacy of mask usage. But it is nice to see just graphically where people have fallen on this line. And also when they heard about coronavirus, there could be something there regarding the knowledge of COVID and how more likely you are to prepare and be ready mentally and also physically and financially for this COVID experience that would be maybe coming your way, right? So the other important variable I'll highlight is this.
Just to give you the sign that we're actually already running out of time for your talk. So if you want to maybe wrap up.
Okay, sure. I'll just end because I only have one more slide here. Is with this graph here where we find COVID lifestyle change, the degree of people feeling that COVID has changed their life being slightly correlated with more mask usage, meaning that those people that are endorsing mask usage, they're also more likely to be feeling this lifestyle change in terms of this COVID experience. So our next steps are basically to look at the within individual, within country, and between country, and to gather this country level and regional level data to look at cross-cultural variables and those impacts on people's experiences. Thank you again, and thanks to my team here, and that's the end of my talk.
Thank you so much, Alex. It was actually fantastic in so many ways. Firstly, and this is in no particular order, I think we are seeing a really very interesting comparison perhaps that could be made across these three big special holidays. You mentioned Chinese New Year, but we've also heard about Memorial Day in the US and St. Patrick's Day in Ireland. And I wonder whether maybe we can somehow put all of you guys together in a room for one of our special workshops to see if there's something we can do with these special holiday data. You've said so much, and I think one of the big overarching messages you had, which I think we need to all hear loud and clear, is that we can't use these big broad brushstrokes and say China. I really found your contrast between wheat and rice fascinating. I had no idea. So my mind is going mad right now. But maybe we can just focus in on one question, which is this idea of compliance, which I think is basically the core of what you're talking about. Compliance is a function of internally generated norms or opinions versus compliance based on the outside world, either what I'm seeing other people doing or indeed based on policy. And I wonder if you can, you also at some point mentioned that you looked into news sources, and I think it might be interesting for you to also tie in with either David Schieferdecher from yesterday's talk, who's also talking about news sources in Germany, and maybe there's a nice cross-cultural comparison that could be done there. But maybe you could you talked about non-compliance, and so basically, do you want to tell us a little bit more? You showed that really nice slide of people saying, either it's because they couldn't find masks, and I think we either think they're lying or that they really can't get masks. But the more interesting ones maybe are the people who are saying, they've been subjected to abuse or are being discriminated against.
I'll speak to this in two fronts. So first, within China, I can say that this compliance was enforced by police. Like they had drones flying overhead and would report to people, put on your mask. So very extreme measures to capture those people that were wearing masks. But it was effective and it obviously worked and people started wearing masks. So within China, there was that going on and they were very strict about mask usage and actually fining people immediately, like within those first few days. More importantly, this U.S. or the international students and how they wanted to wear masks. So it's almost like this lack of control, but they want to comply with the social norm of the local environment. But they know inside that these masks work. They know inside from these people back in China or from Asia that these masks are going to be useful. And now it's like, oh my. But it's like for them, it's like this struggle that they're dealing with, this internal struggle. When they go out, they can't, but they really want to. If they're seen with these big group of Chinese people or Asian people and they're wearing masks, obviously they're bringing attention to each other, to themselves. So what we did was we were able to ask, are you wearing a mask when you go out in public during COVID? And they say yes or no. I want to, I refuse to. And then what we say is, well, if not, why? And they'll give their response. And we had hundreds of responses from, those common ones that I feel discriminated against. Many people would say masks don't work. The government or the health officials don't recommend it. So we're planning on coding all that. And then we're going to look at just that sample and see what we find in terms of comparison. And it's not just like a US sample. I mean, it's Portugal, it's Spain, it's Italy, it's from Germany. I mean, it's all over. I mean, even in like Hong Kong, I think there's a few. So it's a very interesting dynamic because there was just so much misinformation. And you're very right. We should be linking it with where they're getting their news sources, because we ask, are you more likely to get your news sources from your local officials, from Twitter or Facebook, from Asian or
well, I was thinking exactly that you're talking primarily, these expats abroad, people I know who fall into that category, very much still base their news sources at home, as it were. Yeah. And so they're clearly, we talked about this ping pong effect with Jamie Pennebaker yesterday, that, maybe some of the spikes you see in the US is because they're watching European news where, new flare-ups come and you have, the ping pong back home in China or Hong Kong, and then clearly you have something similar. Unfortunately, I have to bring our discussion to a close despite how fascinating it is. But hopefully we can have some follow-up discussion, maybe when you have some of this non-compliance data ready. So as I've said, we will be having some workshops. And one thing that has occurred to me is we need a cross-cultural workshop, and perhaps we can invite you to discuss with us then. So without further ado, I thank you, first of all, Alex English, for your fascinating talk. And I introduce our next speaker for the day. Joining us, I think, from Russia is Professor Elena Leonova. And she is, I can see you, Elena, welcome. And may I ask you to try and say something? You're on mute, I think.